Chronic pain is defined the pain which has been present for more than 3 months. This definition is the most recent definition, but again, it's not the time frame. For instance, a few years ago, the chronic pain was defined as the pain which has been present there for more than 6 months. Again, there is no classic cutoff between the acute pain and the chronic pain, and we should not define this condition by just the amount of time that it has been present. The most important definition between these two conditions are the actual pathology of what defines that condition. Acute pain is when we experience pain in any part of the body, and usually there is an explanation on why there is a pain. Let's say a brick falls into the toe and the toe is broken, so the person will experience pain there because either the bone is broken or the tissue has been damaged, and there is usually a reason for that. And if that pain persists for more than 3 months, by definition that becomes chronic pain. But what's important is the actual pathway, how that pain becomes chronic pain. The misconception is where the chronic pain resides. So how does the pain become chronic? When the pain travels from an affected body part to the brain, it usually gets synapsed or connected to other neurons in a level of the spinal cord, at the level of the spinal cord, and then also at the level of the brain itself. So by the time pain becomes chronic, that sensation by definition resides in the brain itself and not the affected body part. And that is the most fundamental difference between acute pain and the chronic pain. That acute pain resides in affected body part, whether it's your back, neck, knee, ankle, etc., versus chronic pain, where the sensation and the pain itself actually resides in the central nervous system or the brain itself. How does chronic pain and addiction are related? It is a very complicated question, and I doubt that I'll be able to answer it in just a few words. But for simplicity purpose, I like to think of chronic pain as an addiction to pain, because there are many similarities between chronic pain and addiction. One has to treat the source of the pain. So to simplify things, we have to address the brain when we're treating the chronic pain.